Hello and welcome. Today, we're going to tackle a condition that sounds really scary but is often very manageable: heart failure. We're going to break down what it is, what to look for, and how it's handled, so you walk away with a clear and hopefully reassuring picture. Let's dive in.
Okay, first things first. Let's just get this out of the way because it's the biggest misconception out there. The term heart failure is, it's alarming, but it absolutely does not mean your heart has stopped working or is about to. Not at all. All it means is that the heart isn't pumping as efficiently as it needs to get your body all the blood and oxygen it's asking for. It's a chronic condition, for sure, but it's a manageable one.
In this image right here, it really shows you what's going on at the core of the issue. On one side, you've got a healthy, strong heart, pumping away. But on the other, you see a heart affected by failure. The muscle is weakened, it just can't squeeze with the same oomph, which means less of that good, oxygen-rich blood is getting out to the rest of the body.
I really want to pause on this because this message from the American Heart Association is so important. A diagnosis of heart failure is not a final verdict. It's not the end of the road. With the right care plan, people with heart failure can and absolutely do lead full, active, enjoyable lives. The key is just understanding the condition.
So how do you even know? How does this condition actually show up? Well, the very first step in getting a handle on heart failure is knowing what warning signs your body might be sending you. This infographic gives us a really nice, quick snapshot of the main symptoms. You can see icons for things like being short of breath, swelling, and just feeling tired. So let's take a closer look at what's actually causing these things.
What's really interesting here is how all these symptoms are connected. It all comes back to that less effective pump. Because the heart isn't pumping as well, fluid can kind of back up in the system. That's what causes the swelling you see in the legs and belly, and it can also lead to really sudden weight gain. And guess what? That same fluid backup in the lungs is what causes the breathlessness and that persistent cough. It all just puts extra strain on the body, which leads to that deep feeling of fatigue. It all makes sense when you see it laid out like this.
And this is absolutely critical, so listen up. While a lot of symptoms can come on slowly, some are emergencies. If you get sudden chest pain, if you feel like you're going to pass out, or your heart is racing or fluttering like crazy, do not wait. That is a call 911 moment right away.
All right, so we've talked about the what, the symptoms. Now let's get into the how. Understanding the mechanics of what's happening to the heart is really key to understanding the different types of heart failure and, of course, how to treat them.
So, most of the time, heart failure starts on the left side of the heart, and it usually falls into one of two buckets. Honestly, the simplest way to think about it is this. It's either a pumping problem or a filling problem. Systolic failure, that's the pumping problem. The heart muscle is just too weak to contract with enough force. Diastolic failure, on the other hand, is a filling problem. The heart muscle has gotten stiff and it can't relax properly to fill up with blood between beats. See the difference? Pumping versus filling?
And you might be surprised at just how common that stiff heart or filling problem actually is. I mean, look at this. Studies are estimating that diastolic failure accounts for a huge chunk of all heart failure cases. We're talking somewhere between 40 and 60%. That's a lot. Okay, so to keep track of a chronic condition like this, doctors use a system of stages and classes. Let's look at how this system basically gives everyone a roadmap to follow, for patients and for their doctors.
I really love this roadmap analogy. It's perfect. This isn't about getting some scary label slapped on you. It's about knowing where you are on the journey. This map just helps doctors see how things are progressing and helps them pick the absolute best treatment for you at that specific point in time.
The American Heart Association breaks down the journey into 4 main stages. So, stage A, that's for people who are at high risk. Maybe they have high blood pressure or diabetes, but there's no actual heart disease yet. Then in stage B, there is structural heart disease, but still no symptoms. Stage C is when the symptoms start to show up. And finally, stage D is for advanced heart failure that needs more specialized care.
Now, for people who are in stage C or D, doctors add another layer to that map. It's called a functional classification, and it's all about measuring how much the symptoms are actually getting in the way of a person's day-to-day life.
The most common system for this is from the New York Heart Association, or NYHA. As you can see, it's a pretty straightforward 4-class system. Class 1 basically means no real limitations on physical activity. By Class 2, something ordinary, like climbing a flight of stairs, might cause symptoms. In Class 3, even less than ordinary activity causes symptoms. And by Class 4, symptoms can show up even when you're just sitting and resting.
And this brings us to what I think is the most empowering part of all this, managing the condition, right? Knowledge is power, but taking action is everything. So let's look at some proactive steps you can take to manage heart failure well.
Okay, one of the single biggest lifestyle changes you can make is managing how much sodium you eat. Why? Well, sodium makes your body hold on to fluid, and all that extra fluid puts more strain on your heart. It's that simple. So for a lot of people with heart failure, the recommendation is to get that daily sodium down to around 1,500 milligrams. That's a real concrete number that can make a massive difference in controlling symptoms like swelling and breathlessness.
And check this out. This is an incredibly useful tool from the American Heart Association. It's their self-check plan, and it's designed to help you keep an eye on your symptoms at home every single day so you can catch any warning signs early. The plan uses a super simple traffic light system. Green means you're doing great, everything's stable, keep doing what you're doing. But if you find yourself in the yellow zone, maybe you have a new cough or you've suddenly gained a couple of pounds, that's your signal. Time to call the doctor. And the red zone, that's a medical alert. Severe shortness of breath, things like that, it means you need to get checked out right away. This really puts you in the driver's seat of your own care.
So, as we've seen, heart failure is a complex journey, but it is a manageable one. Understanding the definitions, the symptoms, the stages, it gives you a clear roadmap. It turns something that feels overwhelming into a series of steps you can actually navigate. So the real question I want to leave you with is this. How can this roadmap, this knowledge, help you navigate your journey? Thanks for watching.
Heart failure. It's a condition that affects millions. So today, we're breaking down what it really means.
Think about it. Your heart is this incredible pump, sending life-giving blood to your entire body. So what happens when that super important pump starts to, well, lose some of its power?
Now, this doesn't mean your heart has stopped. It just means it's not pumping as well as it should.
You can see here how the muscle gets weaker, which makes it a lot harder to pump effectively.
But here's the key thing. People can still lead full, really enjoyable lives with this condition.
So how would you even know? Let's get right into the key warning signs to look for.
Feeling short of breath is a big one, especially when you're lying down. A nagging cough, too.
Also, keep an eye out for swelling in your legs, feeling tired all the time, or sudden weight gain.
Okay, so what actually causes this? What makes the heart weaken in the first place?
Well, things like high blood pressure and damage from a heart attack are two of the biggest culprits.
It often starts on the heart's left side. It's either a problem with pumping or with filling up. Doctors actually classify it into 4 stages, going from just being at risk all the way to advanced.
But here's the good news. The goal is simple. Manage it so you can live a longer, better life.
And your lifestyle. That's your first line of defense. Diet and exercise are absolutely huge.
Speaking of diet, cutting way back on sodium is crucial. This is a pretty common daily target. Medications also play a huge role. They basically help ease the heart's total workload. For more severe cases, there are advanced treatments like pacemakers and even heart transplants. And it is so important to know when it's an emergency. If you see these signs, call 911 immediately.
A self-check plan is a great tool. It helps you track symptoms and know exactly when to call for help.
The main takeaway is that managing this is a partnership. So, what's your plan for your best heart health?